Have you been suffering with pain maybe in the groin area? Is it uncomfortable at night to lay on your side with pain on the outside of your hip? After you've been sitting for a while, is it difficult to get up because you have some hip or groin pain? Well, it's probably suffering from a very common problem that I see in my practice. Outside of back and neck conditions, shoulder and hip problems are probably the most common. That set of complaints that I just listed off, pain in the groin area or the outside of the hip, especially after sitting, difficult taking those first few steps after sitting down are common to almost all of these hip conditions that we treat here in our office. Let me explain how this condition occurs, and then I'll give you a brief explanation of what we can do about this. The hip joint is a ball and socket type of joint. Your femur, which is your thigh bone, kind of has a rounded end on it. It angles into this ball and socket. The actual hip joint is really located more in the groin area than on the outside of the thigh, where most of my patients point to where they think their hip is at. So it's kind of a little bit deeper in because of the angle of the head of that femur bone. But anyway, it's designed with a very large range of motion as that ball sits in there. But unfortunately, most of us during our activities of daily living, during a normal day, don't put the hip through this full range of motion. Little cobwebs, little adhesions can start to form in that ball and socket, and then those start to agitate the soft tissue around the hip, and that's where the soreness and pain comes from. So the problem results from us not getting this joint through a full range of motion, although we use the hip every single day. That's the cause. What do you think the cure, might be for this hip problem? Well, that's right. We've got to get the joint moving. We have some very specific exercises and techniques that chiropractors do to try to get this hip joint stimulated and moving a little bit better. We're uniquely trained to find these adhesions and get to the root of the problem. As chiropractors, we don't cover up symptoms with pills, potions, or lotions. We have to find out actually what's causing your problem and improve the function of that particular area. So don't let what you think might be a minor problem with a little hip or groin pain progress. I believe this adhesion problem that I see so often in my practice is the very first step in the degenerative hip disease that years later could result in a hip replacement. So don't ignore this particular pain. I want you to call my office, 239-267-3133. Set up a convenient appointment with my receptionist. I'll sit down with you. You can tell me exactly what you're experiencing. We'll do a physical examination to try to get at the root of your problem and then come up with a solution for your problem. If I don't believe that I can help you, I will do my very best to get you to someone that I do think will help you. Fair enough? Well, give me a call today. I look forward to meeting with you soon.